Hey everybody, welcome back to the channel. We're going to take on another episode of the Pitt, episode 3, which I guess is titled 9 a.m. So we are now 2 hours into this busy ER shift. A lot has happened in 2 hours. We appreciate all the comments we had on our first episode. We did have a little bit of an audio issue. We have, I think, corrected that. We do appreciate, though, the constructive comments being very generous and helpful. Nobody was on there tearing us down about it, saying, hey, this is stupid. So we're grateful for that because truly we have no idea what we're doing. We're just
fumbling through it.
Figuring it out as we go. And you may notice a little bit of a different setup. We decided to try something new so that way we could mess something up again. No, I think we got it this time. A little shout out to, we had a comment about the Bengals. I thought I'd wear this to that viewer. Shout out Houday. But yeah.
Let's give a little shout out to our friend Mark at One Louder Studio for helping us try to navigate some of these audio issues.
Thank you, Mark, the audio guru.
Yeah.
Hopefully we've made you proud tonight. And I'm going to try to be a little more
normal.
Well,
less stuffy.
When we first started shooting these episodes, well, not these episodes, but the podcast, you actually made the comment, you actually referred to me as Dr. Boring. I guess, so believe it or not, being on camera doesn't come natural to me. It's a little bit awkward.
It's completely natural to me.
Yeah.
I'm just kidding.
Like, I feel like Ricky Bobby from Talladega Nights, where it's like, I don't know what to do with my hands kind of thing. And so actually, well, here now, like I keep looking down at the screen here, getting ready to watch TV instead of looking at you. So hopefully as time goes on, we'll fix that and I'll be a little bit better. So I'm going to stare at you. But anyway, thanks for being here. Thanks for being kind. Let's get into episode 3. We're excited to dive into even more of this. All right, let's get started.
All right, let's do it.
Let's jump in. 9 a.m. I think a lot has happened in this 2-hour shift of the ER.
Oh, yeah. I hadn't even really thought of it that way. He had unfortunately lost that patient.
Oh, wow. So we're working.
Or he's losing him.
Oh, shit. What? I think I just broke some ribs.
It means you're doing it right.
That is a very common expression in the hospital. If you fracture ribs during CPR, that's, hey, it means you did it right.
Dr. McKay seems nice.
Cassie? Oh, yeah, she's great.
She been here long?
A little while. Why?
I'm just curious.
Trying to figure out why she's got the ankle monitor.
Before she came here.
What she did. What do you mean, like school?
See if
like
she should trust her.
work,
Get to know her better.
personal life.
Sure.
Then why is Robbie keeping him here?
I don't know.
So
Maybe he sees something we don't.
Or maybe he's hoping.
There's a
for
few
something
times so
different.
far now in
What's
this
there?
show where that particular doctor, and I can't remember his name, I think he's one of the senior residents, and he seems to be a little more calloused. He's not wrong. He's ready to move on, right? Like he sees a brain dead patient who in his eyes has there's no meaningful chance of recovery unless, like he was saying, unless he's a candidate for organ donation. Then why are we keeping him here in the ER? Whereas then Dr. Robbie, the main character, is still taking this as, hey, like I'm treating these parents just as much as I'm treating this individual, this patient. You see that a lot in medicine, a couple of different approaches. I don't know that you can say one of them is necessarily right. Although he's awfully calloused as a resident, though. That I guess that's a little interesting because I think he is a resident at the end of the day. And
Yeah.
So yeah.
He's a chief resident, but still resident.
Perhaps. Not that I don't dislike the character. I mean, he seems like he knows what he's doing, but it does seem to maybe lack a little bit of that empathy.
Yeah.
I think, which is crucial. I mean, you can be the smartest person in the room, but if you have zero ability to communicate and you're not empathetic, then you're just a smart person in the room. You're not a complete doctor, in my opinion.
When are you due?
I had a client ask me once how far along I
You can
was.
always tell.
Were you pregnant?
Congratulations.
That's why you never ask.
Didn't have any kids at the time.
Really?
And I'm sorry if my sister comes across a little strident.
It's
Okay. This isn't easy.
I like that word.
About the rats.
What about them?
They've been caught?
I have no idea.
We'll find out.
Not sure that's my job.
You're in charge of the ER. The rats.
Yeah, but he's not an exterminator.
Pupils pinpoint. I need.
Narcan.
Yeah.
Another overdose. So you notice how everybody's standing around. They recognize that this is futile, but they're letting him continue because they've all had that patient that they refuse to give up on.
Yeah.
And so they are going to help him until he is ready.
Oh, wow. Is it like...
Welcome back.
It's really alert. I guess does it work like that?
Narcan is very quick.
Wow.
Now, I've personally never had to admit, I take that back. We have Narcan people on the floor who were overdosed on opiates that were actually given, but never like in an ER setting or out in the field, as they say.
What'd you take, Jenna?
Nothing.
You had to have taken something to cause this.
Like half a Xanax.
I don't
That's
think half
not
of Xanax
nothing.
did that,
No. Half a Xanax that she got,
unless it was something that was
Did you
laced.
take Xanax
yeah,
before?
she got from somebody else.
I'm sorry.
I think you might be right.
Yeah, so I made the comment that I think this girl may be autistic.
She's trying to calm herself
Are
down.
you okay?
Yeah.
You sure?
Yeah,
I,
she looks like she's stimming
on occasion, I have an emotional response to death.
on occasion. Yeah, I mean, I knew I actually I
Gotta be
liked her
kinda
from
tough
the
for a
beginning,
doctor.
but I think I like her more now.
That's it. That's all I got.
So it's more clear now, like
Yeah.
some of those socially awkward situations,
It's sad though that she feels like she has to be different,
or like try to act like
Yeah.
Okay.
try to quote fit in.
try to suppress
That's
it.
it. No, our social worker Kiara is here if you want to talk.
So he's doctor to
Okay,
everybody.
Did you have they have support like that for you in the hospital when losing a patient?
There is.
How did you have time for it?
I never utilized it. They kind of call so there's this sort of initiative called the Second Victim Initiative, meaning when something tragic happens like that, when a life is lost, there's a second victim. And so, we cater to the family too. He's displayed many times. But you also should cater to the medical team. And that's kind of what he was doing right there. But who caters to him?
Well, people are trying to cater to him. He's just not allowing it.
Yeah, I mean, some people are checking in on him.
Yeah.
He's definitely kind of closed off from that. He's deflecting a lot of those, and I understand why, but my suspicion is that it will come to a little bit of a head. That first doctor that he ran into, he went up to the roof to find him.
Yeah.
And I think we'll be back on the roof. I think, but this time it'll be him.
Not needing saving.
Yeah.
Apnea test. We keep him on 100% oxygen, but the ventilator won't be giving him breaths.
So this actually, I think, brings up a pretty interesting physiologic concept. Most people probably don't know our respiratory drive, the brain telling us to breathe, is actually not driven by oxygen levels. It's driven by CO2 levels.
Definitely means that Nick's brainstem is not triggering him to breathe.
Well, how can you fix that?
What happened is CO2 levels rise to the point where it should have initiated the brainstem should have told the body to breathe, and it did not,
Okay.
which meant that there was no brainstem activity.
Yeah.
So that's what that test was showing.
Shake it first. Oh, but make sure the lid is
Gosh,
screwed down tight.
those days just got worse.
Yep.
Catheter in his jugular vein down into his heart. And
So,
administer Levophed.
this is a
Very
common
powerful
thing.
med-
What I'm noticing too, there's a lot of overlap between this show and maybe things that would be happening also like in the ICU setting.
Oh yeah.
Because-
That would typically, right?
Like this kind of feels like a blend of the ER and the ICU to me. Because in my residency, I spent probably 6 months of that time working in the ICU. Loved the ICU, some of the most amazing nurses you'll ever come across. But the acuity, and this is kind of like that kind of death and destruction. You'd go shifts where more than one patient died a shift, and maybe multiple days in a row. And so the ICU, they're kind of blending the two. And frankly, I think the show's maybe alluded to it, like they should be in the ICU. They just don't have.
They don't have the beds.
Right, they don't have the bed, or the hospital's keeping them in the ER.
In
but
the pit.
in the pit, yeah, not in the jungle. But I'm going to start a medical show and call it The Jungle. It's going to be in Cincinnati. But anyway, but there's definitely a lot of overlap here with the ICU. But what he's highlighting here is there are a lot of things that we can do. They can run a catheter, a central line triple lumen catheter through one of the big veins in the neck, run it through into the heart, up into the superior vena cava, discharge it in the heart, give a very powerful medicine that can constrict his blood vessels to push his blood pressure up. But what's that going to do? Well, that's likely then going to limit blood supply peripherally, because it's going to constrict those vessels. And so you can see modeling of skin, you can see ischemia to distal parts of the body. That basically what that means is reduced blood flow. And so everything that you do has a consequence. And that's kind of what we're getting into here. We can do all these things, but also being honest about what the likelihood that any of these things are going to have, real value. But again, it goes back to the family not being ready. And that's hard because in this case, they may never be ready. So anyway, that's kind of what I say, because I've been thinking about that for a little bit, that kind of ICU ER overlap.
Where did you get drugs?
Who are you?
Did you give them to my son?
So
Did
yeah,
you
we're
give
getting a
my
lot more
son
drama now.
drugs?
Yeah.
The truth is, you're not a real doctor till you've lost at least one patient.
I don't think I agree with that.
You
I,
gotta-
I think you're a real doctor before you lose a patient.
He saw a squirrel, and it's my wife's dog. Damn thing doesn't even like me.
Clearly. Where's the dog now?
Hopefully in a kill shelter.
So these patients are funnier than I think what we tend to see in kind of real life ER setting. I never used one of those.
Did you have them?
A scrub dispenser?
Yeah.
No, we had, it was like traditional. We would put our dirty scrubs in like laundry to be washed, and then you would just grab them from a stack.
Their scrubs look a little nicer.
The scrubs are a lot nicer.
But you don't want to be wrong about this one.
I know.
Yeah, I think this is
So
one
what's
you
the
have to
issue?
report.
Yeah.
Maybe I don't want to ruin this kid's life.
I mean, I understand what he's
don't want to ruin
saying,
him,
but
anyone else's life
you
either.
absolutely can't err on. You have to, if you're going to err, you have to err on the side of protecting a whole lot more people.
Oh, yeah.
What was the name of that cop you were talking to earlier?
What cop?
The good-looking one that you were talking to.
Do you think there's anything between those guys, those two,
Stay in your own
Oh, I don't know.
romantically?
Oh.
I'm not even asking like that.
Because she's pregnant.
I really did
Pregnant
want to talk to
too.
him about something.
Yeah.
Hey, been looking all over for you. We need a cardiovert, unstable AFib in North 1.
Okay, just give me a sec.
Did you ever interrupt your attending while they were...
Me.
No.
35-year-old
No, never.
architects working on a deadline, vaping nicotine.
I also
all
never
night.
wear my stethoscope into the bathroom.
AFib at 147.
Intentionally. I
Mr.
mean,
Quinn, this is
Yeah.
Dr.
'cause
Robbie.
he hasn't sanitized that thing since he left the bathroom.
When did your palpitations
Well.
Just saying.
Might have found a flaw there with the show.
Yeah.
I'll be with you. You can decide when you want to leave.
I honestly don't know how you could deal with that possibly multiple times a day.
We use the term desensitize a lot. I don't know if that's necessarily true. Sometimes I don't like that word because I think it sounds a little callous, because it almost sounds like we sort of detach emotionally. There are always going to be those moments that stick out that get to you. You do hear a lot of jokes is maybe not the right word, but like you'll hear comments, and I remember hearing this at the hospital, that are very kind of borderline inappropriate. And it was always one of those things where it's like, gosh, hopefully nobody hears these things being said. But it's sort of that sick, twisted sense of humor that sometimes some folks develop, right? Because humor at the end of the day is a coping mechanism, right? It is a defense mechanism. It's how some people cope with things.
Like with that, when I was pregnant with our son, and the placenta was on top, they could never hear his heartbeat.
Yeah.
Every time I went in.
Yeah.
So it was every time I went in, I got this uncomfortable look from the doctors as they were trying to find the heartbeat, and then they couldn't find the heartbeat, and then I would have to get an ultrasound. It makes you uncomfortable because you can feel that they're uncomfortable. So that's when I made the joke about maybe he was playing dead. I mean, it was just like, I had to like say something because it was so uncomfortable.
So you went with the strategy to make them way more uncomfortable.
I mean, it was, I don't think it worked for them.
yeah.
It helped me.
Well, our son is alive and well,
Sorry, God, that's horrible.
age 6 now. And I maybe,
I was saying with humor, like how you deal with
I know.
uncomfortable situations.
But maybe an
With humor.
appropriate time, though, to kind of jump in here and say, and I can't, is it Mel, the character? Perhaps why I think we've developed such an affinity for Mel, the autistic resident, is because our son is autistic.
Yeah.
And so seeing some of those kind of similar, I mean, he's only 6, but, and it actually was, I got the suspicion that she was when we were actually watching back the prior episode that we reacted to.
Like
When I
we
was,
were editing.
yeah, I was editing it, watching it back. And then because when that mother whose son had taken the gummy had made the comment that he was probably going to be autistic now or something, and you could see how that affected her, like how like she was very off put by, Mel was very off put by that comment. Like there's no evidence of that. And it was like, oh, wait a minute. And then of course this episode brought a lot more of that on. So anyway, that's I think maybe why we've developed a little bit of an affinity for her. Ending with another sad patient family having to say goodbye. A little different here, obviously. But you even heard her say that, I'm not giving up or something along those lines. That's really, it all comes back to that feeling of giving up. And nobody wants to feel that they've given up. So anyway, but no, another good episode. So episode 3 in the books. We are now 3 full hours into this ER shift. I'm curious in episode 4 if he finally gets to pee. We'll see. I hope he does. I think he'll feel better. I don't know, any major take? I mean, I know, by the way, with this episode, we tried to do a little bit more dialogue or a little bit more, I guess, insight when things happen that kind of piqued our interest that way. Because I know the last couple episodes we've had...
He had his handy dandy notebook.
Yeah. And, well, did those, like, really long, like, 10, 15-minute wrap-up video.
Yeah.
Probably not what a lot of people want to see, although...
Let us know.
Yeah,
like maybe that is the way that I don't know.
If you prefer that way, let us know.
Just kind of winging it.
Yeah, I'm happy to modify this.
We're not professionals
as
here.
we go. But yeah,
I will say I did see, and I know we just posted the second episode today, but someone had commented that the reason why he may, Dr. Robbie may look like he knows what he's doing is I guess he played on the show ER.
I didn't see that comment.
Yeah.
Okay.
So I don't know how long that show, or we haven't seen that show.
Okay.
And then said that his mom was a nurse.
The
actor.
The actor's mom.
I think that's what she was saying.
So
she. I don't even know if it's a she. Sorry.
Okay.
I assume. I don't know why I assumed. I didn't even pay attention. Yeah.
So the actor played an ER. And
Noah something.
And his mother, real life mother, is a nurse.
I think so. I think that's the way I understood it.
That helps.
Yeah. I mean, because he looks like...
It looks like he knows what he's doing. So that's interesting. So if he was in ER, and ER was the show with Clooney, right?
I have no idea.
So we've not, like we mentioned in the first episode, really never seen any medical show. I've seen like maybe a couple of...
No. What, have we?
Odd episodes of Scrubs, maybe, or like a partial episode of Scrubs once.
Yeah.
And then maybe like a little bit of the show The Resident.
Yeah.
But so ER never, Grey's Anatomy never. That was, by the way, a big one I always got asked when I was in med school and somebody found out I was in med school, was going to be a doctor. I got asked 2 questions all the time. The first question was, what kind of doctor are you going to be? To which my response was, well, hopefully a good one, because I didn't actually know what specialty I wanted to go into.
Yeah.
And then the second question was, do you watch Grey's Anatomy? To which the answer was no, never had, never have. Unless you guys want us to, then we happily will. But anyway, so ER, I wonder if the shows are connected at all. Like, could he have been like, did he start out in that ER?
I don't know what, well... I don't know. I'd imagine the character name would have to be the same.
Oh, well, that's true.
Yeah.
We could probably Google that. Although I don't know that we should. So I want to wait. I don't want to.
Yeah,
I'm
not really wanting to Google anything.
I don't want to ruin anything.
Yeah, my sister's already trying to ruin stuff.
Yeah, don't.
Nope. I was like, do not tell me anything.
Fight the urge.
She's like, it gets really real. I was like, okay, that's enough.
Well, it seems pretty real so far.
I know.
So I guess it will get more real. But yeah, this kid obviously, we haven't seen the resolution yet of this brain dead young 18-year-old. I think they said he's 18 years old. So that's going to come to a finality, I'm sure, here soon. And then, yeah, we'll see. Well, maybe they'll round up the rats, and then he'll get to go pee, and everybody will be happy. So, all right, well, we will check out episode 4 here soon. But please, we appreciate all the comments we've had.
Yeah.
We appreciate all of the likes, and we appreciate all the subscribers. Consider giving us a subscribe if you're not already subscribed. If you stick around this long to listen to us talk. Until next time, take care.
See ya.